On today's episode of the world's Ok-est Physical Therapist podcast, we are going to be diving into breathing meditations. We're going to be taking it out of the most likely alpine Tibetan plateau that you imagine with the gong in the background and everybody humming together, and putting it on the table in a physical therapy setting. Now, the very first thing that we're going to have to do is we're going to have to acknowledge this is not medical advice and it does not replace you going and being seen by a medical professional for any pathology that you have, especially when it comes to breathing. Breathing is a big one. Going and talking to a medical professional if you have difficulty breathing is the correct first step. This is purely educational and it's intended for physical therapists and the people that are in the physical therapy clinic to talk and have a better and more educated engagement and discussion with their physical therapist to see if this is an approach that is good for them. So, the first thing that we have to acknowledge is the diaphragm is a muscle. It isn't just a respiratory organ. It is, in fact, skeletal muscle, and it's capable of being trained, and it's also, unfortunately, capable of dysfunctional movement patterns that can cause issues. The diaphragm is a dome-shaped muscle that separates the thoracic and the abdominal cavities. When you inhale, it contracts, it flattens, it drops down. It displaces the abdominal contents downward and outward. That is why you associate with a deep breath a belly rise. On exhalation, it relaxes and comes back up and allows the abdominal contents to move back into their original location. Now, why is this important? Well, like I said, deep breathing tends to move the belly, but most adults that are under everyday stress, like you and I, default to what's called apical or accessory breathing. These are short, shallow breaths that are driven by the upper chest, the scalenes, and the upper traps. For all those who are not anatomically inclined, this is the muscles of your neck. This is what we tend to use when we are stressed or taking shorter breaths rather than the diaphragm. This is efficient for a genuine sprint or fight or flight moments, but it is a terrible default pattern for us to live in 24/7. So, why does this matter in the clinic? Chronically overused accessory breathing muscles will contribute to neck and shoulder tension and most likely an upper cross postural pattern. This will lead to reduced rib cage mobility over time. The same muscles that get recruited for accessory breathing and posture will tighten. That means there's not a lot of room left for breathing capacity because they're already being overtaxed in posture. And if they're fortunately not being overtaxed with posture, we can accidentally be overtaxed them just by breathing. So the core connection that we have to make here is that the diaphragm is one of four muscles in the inner core unit. This works alongside the pelvic floor, the transverse abdominis, and the multifidus. It is not a coincidence that breathing retraining shows up in core stability rehabilitation, pelvic floor rehabilitation, and low back pain protocols. They are mechanically linked, they are not separate things. The human body is a whole machine. If you take one thing away from this segment, you cannot out meditate a dysfunctional breathing pattern. You have to fix the mechanics first, and the calming effect becomes easier to access, not the other way around. So, what's actually happening physiologically? When you're doing the breathing, the autonomic nervous system begins to shift. Slow, diaphragmatic breathing, especially with an extended exhale, increases parasympathetic or what's known in the biz as vagal tone, and it down regulates the sympathetic drive. This is a measurable change in terms of heart rate variability, which reliably improves with consistent slow breath practice. Now, there's also something called the vagus nerve mechanism. Stretch receptors in the lungs and the diaphragmatic movement itself stimulate vagal afferents. Slower, deeper breaths, particularly longer exhales relative to inhales, signals safety to the nervous system. This is the physiological basis for why breathing meditation reliably lowers heart rate and blood pressure in the short term. Yes, you heard me right. Breathing impacts your heart rate and your blood pressure. Baroreflex and blood pressure. Slow breathing around 6 breaths per minute tends to align with resonance frequency, where the heart rate and blood pressure oscillations synchronize. This is the mechanism behind resonance frequency breathing, a technique that has evidence based in heart rate variability biofeedback research. Now, this is one that is a clinical pearl that is one of my favorite things to bring up when I'm doing trigger point release and telling people to focus on their breathing. CO2 tolerance and chemoreceptor sensitivity. Chronic overbreathing, that would be hyperventilation, keeps carbon dioxide CO2 chronically low, which paradoxically makes chemoreceptors that track that level of carbon dioxide in the blood more sensitive and perpetuates air hunger in anxiety systems. So basically, because you have low carbon dioxide, that can increase your sense of anxiety. Slow nasal breathing gradually improves CO2 tolerance, which is part of why breathing retraining is used clinically for dysfunctional breathing pattern disorders, not just relaxation. Now, one of the things that comes along with this CO2 imbalance, your muscles are more likely to form trigger points when they have a low carbon dioxide in the blood. This means that they're more excitable and they're more likely to contract and stay contracted. So one of the things that happens in the clinic when I'm trying to release trigger points in patients is I tell them to focus on their breathing. I tell them to breathe in through their nose for 4 seconds, out through the mouth for 8 seconds while I'm doing trigger point release. And I explain to them that because of the chronic sense of stress in their body and in their environment and the fact that they're doing shallow accessory breathing instead of deep diaphragmatic breathing, they're actually leading to changes in their blood chemistry with decreased carbon dioxide, increased oxygen, and that can be one of the mechanisms that's feeding into their trigger points. Slow breathing has also been shown in research to reduce pain sensitivity and improve pain tolerance. This is likely through a combination of autonomic downregulation, attention and interoception effects, and reduced muscle guarding. Relevant for anybody in the clinic, right? This means if it helps with chronic pain, it's not something to be taken lightly. A lot of the patients that will come in that I see post surgery can benefit from this because just by focusing on their breathing, maybe I can get their attention changed. Maybe I can get their internalized focus off of that to focus on their diaphragm instead of their knee or their hip or their shoulder, and that will allow me to do soft tissue mobilization and passive range of motion because now they're not being so introspective on that shoulder or on that ligament or that limb, but they're focusing on their diaphragm instead, and that also has the benefit of causing their parasympathetic system to take over versus the sympathetic system. Breathing meditation helps train the brain's ability to accurately sense internal bodily states. Poor interoception shows up in chronic pain, anxiety, and some movement disorders, and breathing focused practice is one of the more accessible ways to help rebuild that sense. So, what are some common breathing meditation techniques from a clinical perspective? Well, of course, we have diaphragmatic breathings. Sometimes with patients, I have to start with I'm just going to teach you the difference between accessory breathing and diaphragmatic breathing. Hand on chest versus hand on the belly. The belly should rise more than the chest. This is really good for just retraining the baseline um, and trying to get someone to recognize that they can be breathing through their diaphragm versus just trying to breathe through their chest. And as crazy as that sounds, there are plenty of people that I've met that have never realized they could breathe through their belly and have only tried to ever breathe by expanding their chest. Box breathing is another one. This is also called Navy SEAL breathing because the Navy SEALs use it. But the idea is you inhale for 4, you hold for 4, you exhale for 4, you hold for 4. And that's all in terms of seconds. So you breathe in for 4 seconds, hold for 4 seconds, out for 4 seconds, hold for 4 seconds. This is genuinely useful for rapid down regulation before a stressful event. Now, hear me, this is important for before a stressful event. The structure itself is calming. It's the predictability that helps reduce sympathetic arousal. Plus, the breath holds help extend the total cycle time and it increases the CO2 a little bit. Extended exhale breathing, my favorite. In for 4, out for 8. This is an exhale dominant pattern. And this is designed to, well, it's intended to stimulate the vagal tone, since parasympathetic activity is concentrated in exhalation. This is often the single most effective quick relaxation technique to teach. It is simple. All you have to do is breathe in for 4 seconds and breathe out for 8, and you get a pretty fast physiological effect. What I do in the clinic to make sure that someone is counting the correct way is I will put on a metronome, which is not for everybody. It will drive some people crazy, but for me and for most of my patients, it's useful because it lets us know, okay, that has actually been a solid 4 seconds instead of 1, 2, 3, 4, right? So 1, 2, 3, and 4. Resonance frequency breathing, I'm not going to lie, that is something I never heard of before until I started this podcast and I started doing research. The idea is that you do 5 to 6 breaths per minute with roughly 5.5 seconds in and 5.5 seconds out. The technique with the strongest heart rate variability biofeedback research base is this one, resonance frequency breathing. Um, the way that it appears to be taught, and I'm honest, I probably have to do more research on this. It's not something I'm really going to focus on teaching because in the clinic, when I'm dealing with people that are having anxiety and chronic pain, extended breathing and box breathing and diaphragmatic breathing get me where I need to go. But if I was interested for whatever reason, heart rate variability, I would be looking up this one. But basically, it's taught by an app. So that tends to be something more that I think people have to pay for, which is why I probably haven't heard it before. And I've never seen it used in the clinic. I see extended exhale breathing, box breathing, and diaphragmatic breathing used every day. I have never seen resonance frequency breathing used, but it is something that apparently is going on in the research right now. Another one that I've seen, believe it or not, is alternate nostril breathing. This is rooted in I believe it's an Indian tradition. Um, Research for this is definitely lighter than for exhale focused techniques, but patients that really get hooked on this, they report a strong subjective calming effect, a slower cadence that changes their physiological response similar to extended exhale breathing. To which my point is, if it's allergy season and I can't really alternate nostril breathing, why wouldn't I just do extended exhale breathing? There's another one that's very popular, the 4, 7, and 8 style breathing. This was popularized outside of clinical literature. It's essentially an extended breath with a hold variant. It's useful, but the breath hold at the top can be really uncomfortable for people that have anxiety or difficulty counting for time, or they already have some sort of pathology of their cardiovascular system. So it's not one that I use. Again, yeah, I use extended exhale breathing, box breathing, and diaphragmatic breathing while I'm in the clinic. So how does it fit into the PT plan of care? With low back pain, diaphragmatic breathing is one of the number one things that I start with. I have a patient lay on their back, knees bent at 90 degrees, heels resting on the top of a foam box, and I teach them how to do diaphragmatic breathing right away because diaphragmatic function is directly tied into intra-abdominal pressure regulation and core stability. Patients who breathe apically, that's the accessory breathing muscles, often cannot generate efficient trunk stiffness under load. Breathing retraining frequently precedes, for me, core strengthening. And one of the ways this works is I teach someone how to breathe diaphragmatically, and then I teach them how to do a core activation while adding diaphragmatic breathing to teach them to disassociate tensing up the body and holding their breath versus being able to breathe while tensing the core. Pelvic floor rehab. This is not at all my wheelhouse, but I know a little bit about it. The diaphragm and the pelvic floor work hand in hand. They move like a piston. The diaphragm descends, the pelvic floor also descends. The diaphragm rises, the pelvic floor should lift. This is a great topic for a pelvic health physical therapist to discuss with you if you think you have this issue. But basically, your pelvic floor and your diaphragm are supposed to work in sync. And dysfunction in one, like a diaphragm, typically shows up as dysfunction in the other. Breathing retraining is a really core component for most pelvic floor protocols, not an add on, it is essential. Post surgical and post injury guarding. This is, if I could, like, cover this in platinum, I would. Pain and fear of movement after surgery or injury is hugely common, and it produces protective, shallow breathing in the rib cage and in the neck. So, teaching someone how to breathe while you move their surgical limb or you do soft tissue mobilization is critical, in my opinion. It's a great way to start undoing that guarded posture and improve the region's mobility without ever really loading it and just doing passive range of motion. Chest wall conditions, like I talked about with pigeon chests last episode. Anybody who has reduced chest wall compliance like me would benefit, in my opinion, from doing these breathing exercises in order to try expand the ribs and improve basically rib mobility and compliance of the chest wall. Those who have chronic pain and central sensitization, this is another one. Given that the autonomic component and the pain modulation mechanisms that we already talked about, breathing meditation is a legitimate tool to be used. It's not a replacement for exercise. It's not a replacement for manual therapy or any other techniques, but it is a tool that can help lower the nervous system's baseline to make those treatments more effective while you're dealing with someone with chronic pain, anxiety, or central sensitization. By focusing on the breathing, you can help lower the nervous system's baseline, that it's not going to be at the same threat level, which may allow the rest of the program to be more tolerable and to get added benefit out of it. Anxiety, stress, anybody who's dealing with just general increase and I would say excitability, really. Tactical box breathing has real uptake in the military and first responder training for a reason. It's fast, it's portable, and it requires no equipment, and it works under real physiological arousal, not just in a quiet room. I don't necessarily teach that before I do exercise. I teach the extended exhale, but anybody who has anxiety, stress, and that would mean most of the military and veteran population, I think benefits from this. Sports performance and recovery, of course, slow breathing practices, following uh, training can support faster parasympathetic recovery, which has the effects of improved sleep, next day readiness, and reducing stress and helping the body to recognize that the time of stress and fight and flight is over. Which goes for the anxiety and the stress people as well, honestly. It's kind of like you're helping your body communicate via breathing, hey, the time of stress is over, it's time to relax. So, how does one actually teach and practice this? Well, as per always, it usually has to begin with an assessment in the physical therapy clinic. But this would be my, again, educational, not replacing any medical advice or evaluation by a medical professional. I watch how a patient breathes. I'll have them put their hand in their chest, their hand in their belly. I'll observe them for about 60 seconds to see how they're breathing. Most of the time, they're going to be stressed because they know that somebody's watching them breathe, so they might have a little bit more accessory breathing even than they normally would. If I see upper chest dominance, breath holding patterns, slower rate, faster rate, anything like that, I'm thinking that retraining can help. Um, that's kind of useful and seated, but the best way I've found to do is actually having them laying on their back. And that's where I'll notice any asymmetries, I'll notice any imbalances, and then I start with diaphragmatic breathing, laying on their back, hand on the belly, hand on the chest, teaching them to breathe into their belly. Then I take those knees, I bend them up to 90 degrees, I put them on top of a box, and then I usually teach core activation as separate than diaphragmatic breathing. So they learn how to continue to do diaphragmatic breathing while still engaging the core. And then this I usually do for like 10 seconds, 10 times. I have them brace while they're breathing in. Um, but I know that the studies that I have pulled up here usually say, hey, you should go for like 5 to 10, even up to 15 minutes on breathing meditation. But eventually, the idea is that a person should be able to stabilize their core while breathing normally through their diaphragm while seated, standing, and during activity and movement and exercise, which is the real goal after all of this. Um, the goal is eventually, of course, take all these things and find a way to integrate them into movements, into exercise, into the gym, into running, into whatever. Though I guess actually not into running, but more into the gym, more into exercise, finding a way to make sure that they're doing proper diaphragmatic breathing. Now, breathing meditation is a powerful tool, but it is not a cure all. And a lot of people will treat it like a cure all, saying, well, if you just do your breathing meditation, you won't have any stress. It doesn't resolve structural injuries. It doesn't resolve herniated discs. It doesn't heal a torn tendon. It doesn't solve anxiety, but it does support the nervous system and improve movement mechanic tolerance, generally speaking. For anyone who has a significant respiratory disease too, think COPD, severe asthma, restrictive lung issues, some techniques likely need modification. That's where having a trained medical professional really becomes useful. But breath holds and certain paced patterns will likely need to be cleared with a pulmonologist or a respiratory therapist first. Oh, yeah, that reminds me. There's a such thing as a respiratory therapist. They're awesome. This is their bread and butter. It would be a great idea to talk to them if you had any sort of questions about this. For some patients, especially those with a history of trauma, focused attention on breath and body can occasionally increase distress rather than decrease it. This is important to know when you're screening a patient. So if a patient says, hey, I was recently mauled by a bear, maybe this isn't the approach that you want to take, but then again, maybe it is. You're not going to know until you try. So it's just something to watch for and to have a plan to pause and pivot if a patient reports feeling worse, not better. So, what are the take home messages? The diaphragm is a trainable skeletal muscle, and breathing meditation is applied to exercise physiology in a way to help train and strengthen it. It's not just a relaxation technique. The mechanism runs through the vagus nerve in the autonomic nervous system. Slower breathing with a longer exhale reliably shifts you towards a parasympathetic rest and digest state, which can help lower your heart rate and your blood pressure. Technique matters less than three core variables: slowing down, lengthening the exhale, and breathing low into the diaphragm instead of into the chest and the accessory muscles. If this isn't separate from a PT plan of care, this is something that can be interwoven into a physical therapist's plan of care. It can help with low back pain, pelvic floor, post-surgical recovery, chest wall conditions, and chronic pain and anxiety, with anxiety geared towards motion. Consistency will always beat intensity. A few minutes daily helps build the skill instead of just trying to quickly and intensely breathe and try and knock it out. This is a powerful tool, but again, it is not a replacement for anything in rehab. It's something to be paired with, not substituted for. And strengthening and mobility work still will be most likely the biggest thing that anybody would benefit from in a physical therapy clinic, but the breathing meditation and the breathing retraining can, of course, help improve a patient's tolerance to loading and to mobility. Now, this has been the episode on the breathing meditation. This was a member request. Don't forget that you can always join on Patreon or message me here on any of the social medias that you're listening to request for future episodes and topics that you think are interesting. Check out the description for some of the resources that I use to create this. And please don't forget to like, comment, and subscribe and share this with everybody that you know in order to help them navigate the labyrinthine, Byzantine thing that we call the American healthcare system. Now, as always, everybody stay fit, stay awesome, and I will catch you guys in the next episode.